Okay, entonces, ¿qué te hicimos?
Implantes de seno.
So, breast implants. And what type of implants? ¿Qué tipo de implantes?
Silicone.
Silicone. ¿Y dónde te abrimos? Where did we open?
Por el ombligo.
Through the
Todo
belly
fue por el
button.
ombligo.
Everything through the belly button. ¿Y cómo fue tu experiencia? How was your experience?
Muy buena.
Very
No
good.
me puedo quejar.
I cannot complain at all.
En menos de una semana ya estaba trabajando.
Within 1 week, I was already, less than a week, I was already working. Wow. ¿Y tuviste dolor, sangrado, morados, any bruising, bleeding pain?
Nada de dolor.
No, zero
no
pain.
Moretes.
No bruising at all.
Tranquila.
Very, very happy.
Yes.
Very tranquil. Yes. Y no sangrado tampoco.
No
bruising.
sangrado.
No
No.
bleeding.
No.
¿Y cuánto estuviste caminando el primer día? How much were you walking on the first day?
No me acuerdo, pero
I don't
bastante.
remember, but I
Yes.
walked a lot. ¿Te quieres dar vueltita para que te miren? So she's gonna turn around for the side profile and the other side slowly. Very good. And the belly button looks very natural and very good. So this is ahora de frente. So this is a Trans Umbilical Silicone Breast Augmentation. This is a world invention, right? To put silicone implants through the belly button, no scars on her breast or nipples, no scars on her armpits. We're covering the nipples for social media, but she has no scars there. And very fast recovery. I just saw a patient today and she was concerned about the recovery. Well, this is less than a week that she went back to work already. Incredible, right? And much less risk of complications, much less risk of bleeding, near zero. The risk of capsular contracture is 0.2%. Actually, with this approach, that's with saline implants. With silicone, so far we haven't had a... And that probably has to do with a combination of the fact that two of the big theories about capsular contracture, we don't really know what causes capsular contracture, but some of the theories are bleeding, and because the technique that we use with a small incision, and probably even more importantly, the use of tumescent anesthesia, that we have a modified technique here that we use, a special kind of tumescent anesthesia that gives you much less bruising and bleeding and a much faster recovery, but also less risk of capsular contracture because there is less bleeding, less risk of capsular contracture, and also the risk of infection through the belly button, perhaps because the incision is so small, perhaps because the incision is not pressing against the implant, is not pressing against the incision and causing lack of blood supply to the edge of the wound and subsequent infection. Whatever it is, the risk through the belly button is near zero. So as a result, the risk of capsular contracture is also near zero. That's incredible. And I can go on and on forever about the advantages. I love this approach, and I don't understand why women would desire to have two incisions instead of one that can be up to 3 or 4 inches compared to less than an inch through the belly button. Just makes no sense. Thank you. Okay, and I forgot to ask you, what about the nipple sensation, your breast sensation? ¿Cómo se siente el busto, la sensación del busto y del pezón?
Normal, como...
Normal.
Sí.
Like,
Estoy contenta,
yes,
se siente
I'm very
bien,
happy. It
normal.
feels very good. ¿Y cómo se siente el busto al tocarlo? ¿Se sienten los
Natural.
implantes? So
No.
the
Todo
breast
natural.
looks very natural. Also, she cannot feel the implants. This is incredible. And one more turn. Very nice. And the other side. She looks incredible. Well, thank you very much. If you would like to have a procedure like this with minimal complications, minimal scarring, and the only natural scar, which is the belly button, please give us a call, 510-525-7999. Thank you.